You are listening to Hilary Topper on Air, the small business podcast to help you grow both personally and professionally. And now, here's your host, Hilary Topper.
According to the B Foundation for Brain Aneurysm Awareness, an estimated 1 in every 50 people has an unruptured brain aneurysm. One of these aneurysms rupture every 18 minutes. Ruptured brain aneurysms are fatal in about 40% of the cases. Of those who survive, about 66% will suffer some permanent deficit. Another startling statistic is that there's almost 500,000 deaths worldwide each year caused by brain aneurysms, and half the victims are younger than 50 years old. I'm Hilary Topper, and this is Hilary Topper on Air. Today, we are joined by Dr. Christopher Kellner. He is an amazing neurosurgeon at Mount Sinai Health System's Department of Neurosurgery. Full disclosure, Dr. Kellner was my neurosurgeon after discovering an unruptured aneurysm in the back of my head, and he did an amazing job. At my last angiogram, 95% of the aneurysm was gone, so I am truly grateful to him. So, Dr. Kellner, welcome to the show.
Hilary, thank you so much for having me here. And I'm very happy to talk about brain aneurysms, which is something I think about pretty much all day, every day.
Okay. Well, first off, tell us a little bit about your background, where you went to school, your training, and how did you decide to go into neurosurgery? I mean, that's such a, it's not like, oh, I'm going to wake up one day and decide I'm going to be a neurosurgeon. So can you kind of
Yeah,
walk us through that?
yeah. Well, I think when you ask a kid what they're going to do when they grow up, they just give you an answer that they think sounds cool. And maybe that's what I did when I was a kid. And then I just kept saying it enough that eventually it became true. When I was in college, my roommates and I kind of were joking around about what we'd wanted to be when we grew up. And we kind of settled. I don't remember if I said it first or my roommates did, but we kind of were joking around saying each of us said we were going to be neurosurgeons. And then we did all become neurosurgeons, actually. So,
Oh,
it did eventually become true. But I did my medical school studies at Columbia, and then I did my residency in neurosurgery also at Columbia, and came to Mount Sinai where I now work for my endovascular fellowship, which is a 2-year fellowship where you learn specifically how to do procedures where you use the arteries in the body as a way to get to diseases in the brain. And so you're inside the arteries as you move up to the brain. And it turns out this is a great way to treat brain aneurysms because the brain aneurysms are abnormalities that are outpouchings off an artery. And so if you can get to it from the inside and fix it from the inside, perhaps that's better than doing a more formal kind of traditional neurosurgery where you're getting to it from the outside. So with that training, then I stayed on at Mount Sinai and became a cerebrovascular neurosurgeon where I do both the original kind of traditional neurosurgeries, which we sometimes still have to do, and also a lot of the minimally invasive procedures, kind of like the one you had.
Maybe you want to describe what that minimally invasive surgery entails, because I think a lot of people think they hear brain surgery and they think right away you have a craniotomy.
Yeah, exactly. Brain surgery no longer necessarily means you're having any incisions on your head. Fortunately, now we can do so much through the arteries. It's mind-blowing and amazing, and a lot of it has actually even developed in the last 7 years since I've become an attending and in performing my own procedures and taking care of my own patients. The technology we now have allows us to very easily get to any place in the brain inside the arteries, and we have new devices to treat different aneurysms of different shapes, depending where they are, how they're shaped. We'll choose a device specific for that. Some of the options are, if an aneurysm is a nice round shape, kind of like a lollipop, you can put some coils in it, which are these little tiny fine hairs that you fill an aneurysm with. If an aneurysm has more of a shape like a thumb, where it doesn't really have a narrow neck, but it is kind of sticking off an artery, you can put some coils in there and you can hold those coils in either temporarily by putting a balloon up in the main artery while you're putting the coils in to hold it in there, or you can even put a stent in the main artery to hold the coils in as sort of a buttress that stays there. The only issue with a stent is that because it's some metal inside your artery permanently, you have to be on aspirin and Plavix for a few months, which are some blood thinners. A lot of people are on those medications, so they're pretty well tolerated. And then after 3 months, you get to stop the Plavix as long as the stent looks like it's doing well and there are no issues. And then you continue the aspirin lifelong. More recently, we've even developed new technology, not we as in me, but mankind, where you can put a stent in an artery and then the artery will grow around the stent, and the stent helps to guide the body to reconstruct the artery without the aneurysm. So the aneurysm gets excluded over time. That's called a flow diverter. And that's a really cool technology because at the end, a few months to a year after the placement, things look completely normal, like that aneurysm was never there. And so that's a really nice way to guide the body to heal itself and get that aneurysm out of the circulation. So it can't cause any problems. It can't bleed after that.
How do you balance the technical demands of neurosurgery and the emotional and psychological needs of your patients?
That's a great question. Probably the hardest part of the job. Maybe doing neurosurgery when you practice so much is easy, but being there for your patient and understanding the emotional nuances, that's really the hard part because everyone's so different. And so the neurosurgery part takes a lot of training and a lot of dedication. You have to design your entire life around learning the trade and continuing to master the trade. And you want to make sure that every case you go into, you have trained so much that when you finish that case, you did the best job possible for that patient. And that requires a lot of off hours training. And we have models for that and simulators, and we talk about it in conferences and all the nuances. And when I see a case that has a little interesting point that I learned, I'll call up a bunch of friends around the country. Some of them are my old roommates from college, and talk to them about the thing that I recognized, and we kind of share information that way. So it's really a full-time job, and then in terms of the emotional needs of the patients, you've just really got to meet the patient where they are and be there for them as they go through this very challenging process. I think one aspect of that is just general availability. You've got to be available when the patient needs you. That's really critically number one. And you've really got to listen to them when they tell you they've got issues or concerns, and go through them slowly with them and make sure you've, answered their questions and gotten them to the place where they feel comfortable going forward with the treatment.
That leads me to a question that I had actually down the line. But
Yeah.
what I'm curious about is, how do you personally juggle the demands of your job and your family, your private life? You're like working all the time. Like, how do you do that? How do you juggle it all?
I think of it a lot like, you ever read The Cat in the Hat where thing one and thing two are causing a big mess? And then the cat in the hat is trying to balance all the things that thing one and thing two are messing up. And there's an illustration in there where they're all these plates piled up on top of each other, and the cat in the hat's about to fall, and then he does fall. I do think of it like that a lot of the time, where there's just too much to balance with all the demands, and the personal life does take a hit. And so you've got to have people in your personal life that understand the mission and support you in the mission. And without that, it wouldn't be possible. So
Yeah,
I thank my family for that every day.
for sure. Um, You also talked a little bit about, how you need to be compassionate, right, to these patients. How do you build trust and a strong doctor-patient relationship, especially when dealing with a life-altering diagnosis?
Well, I think that is something nobody really knows the answer to. But I can tell you what I try to do is present all the information I know so that there's some shared decision making. Most patients want to participate in the decision making. Some patients say, "Doc, I don't want to know, just do what you've got to do." And I appreciate that if that's where a patient's coming from. But I think that at least in New York City, most people want to know the data. They want to read the studies. They want to talk to the other neurosurgeons and hear what they've got to say about it. And so most patients, you've got to really give them all the knowledge you've got and go through the risks in detail and make sure that you're not leaving anything out, and you make a decision together about it. I think providing the information in a honest, unbiased manner, and then coming to a decision together is really the essential foundation of the trust in the patient-doctor relationship.
Yeah, I love that. Well, before we move on, I have to say I'm so appreciative of our sponsors and must take the time out to thank them. Please support our sponsors and tell them that you heard about them on Hilary Topper on Air. Special thanks to the Russo Law Group, Long Island Signature, Estate Planning, Elder Law, and Special Needs Law Firm, and Buddha Bath, a natural bath and body care company that offers a wide variety of products, including body butters, bath bombs, soap bars, and sugar scrubs. Now back to you. So I want to thank you and Mount Sinai Health System Department of Neurosurgery for sponsoring the Lori Weiss Memorial Fun Run Walk on September 14th. How do events like this run walk contribute to raising awareness and funding for neurosurgery research and patient care?
Yeah, I mean, it's honestly, it's so important. Um, that fun run, I believe, is helping to fund the B Foundation, if I remember correctly. That's
Yes.
accurate? And I can tell you the B Foundation has funded dozens, maybe more, um, young neurosurgeons and neurologists and neurointerventionists who are doing brain aneurysm research. And many of those people have gone on to have successful research careers. So you can think of it like a little bit of startup capital coming into a small company, or like someone someone just getting started and getting that initial push to get the pilot data necessary to apply to a larger NIH grant. And they fill a gap in the research development of a person's career where they're unable to get that initial funding to just get that initial data to get started. And so it's so essential to have that. And the B Foundation, it does an amazing job screening and finding and motivating people to get involved in research because they provide this funding necessary for people to get started with. And then those people have gone on, and this has been going on for more than 10 years to my knowledge. And even when I was a young investigator, got a research grant from them. They really kickstarted my research career. So I'm very thankful to them for that. And it's really an essential component of the entire process.
What did you do research in through that grant?
Well, there are actually two projects. One of them was trying to develop a blood test for a brain aneurysm so that a person can have a blood test and you can have the proteins in the blood analyzed, and then you might see a protein signature for the presence of an aneurysm. Imagine that your blood is flowing through an aneurysm, and the aneurysm has certain inflammatory features, and maybe it's impacting the blood in a way that lets that blood know there's an aneurysm somewhere in this person's system. And then you would be able to see those aneurysm specific proteins when you do a blood test. And we did actually identify a panel of proteins. And then we did actually apply for a patent to describe those
Wow.
proteins. And we did actually, and are submitting a scientific paper to describe that set of proteins. So It really was an interesting project, and came up with some results that could be very actionable in the future.
I have another couple of questions. If somebody has an aneurysm, do should it always be dealt with? Is that, I've come into contact with so many different people through
Yeah,
this journey, and I'm
yeah,
just wondering, like, if somebody was diagnosed with an aneurysm, should they take it the next step and seek a
yeah.
neurosurgeon?
Great question. You mentioned initially that 1 in 50 people have a brain aneurysm, and that's accurate. And then another fact, though, is about 1% of aneurysms will ever rupture. So 99% will not rupture. So what we have to do as physicians is use the information that we know from all the studies that took place over the last 30 years and use those features of aneurysms that predict rupture to identify the patients that need treatment. And those features that predict rupture are the size of the aneurysm and the location of the aneurysm and the shape of the aneurysm, as well as some other factors, like if the patient is a smoker and is going to continue being a smoker, and if the patient has a family history of a rupture or an aneurysm in the patient's family history. So when we take all that information together, we can assign a risk per year of the aneurysm rupturing. And if that risk is high, then we recommend treatment. But in many cases, if the aneurysm is small and in a safe location, we often recommend observation instead of treatment. And that might be shocking initially to think you're just going to live with this brain aneurysm, but sometimes the risk of a brain aneurysm rupturing is so low, so much less than 1% per year, that it doesn't make sense to go forward with a surgery to treat it, because even though the surgeries are very safe these days, and we can do them through those minimally invasive approaches we were talking about before, it's not even worth taking any risk because the risk is so low of the aneurysm rupturing. I'll tell you that most of the patients that I see with brain aneurysms go the route of observation. And that's where that shared decision making comes in, where you give them the exact facts about what we know about the aneurysm rupture risk for that aneurysm for that person, and talk about what the surgical risks are, which are very low, but still, you don't want to take any risk if your aneurysm is a low risk aneurysm. So it comes to looking at the exact features and of that patient and that aneurysm.
Talk to us a little bit about family members, right? So you have a family member, maybe that person passed away like my sister did, or maybe that person was a survivor of a brain aneurysm rupture. What's the likelihood that somebody else in the family can potentially have the same issue?
Great question. Most aneurysms are actually not in families, they're not familial, but there are some genes that we already know about, and there are many genes we don't know about that increase your chance of having an aneurysm. And the chance of an aneurysm running in the family, if you just meet a person and they're discovered to have an aneurysm, is about 10 to 15%. So the minority of aneurysms run in families. But if you and a family member have aneurysms, then the recommendation is that the other immediate family members do get screened for aneurysms. So if one person has one, you don't need to get screened, but we can work it out if you want to get screened. But the indication and the guidelines say you should get screened if two family members have aneurysms.
Now, reflecting on your journey, what's been the most rewarding aspect of your career as a neurosurgeon so far?
There's no question it's when you see a patient for follow-up, whether it's 3 months or a year, and you can tell that patient that they're cured of that problem that they came to you for. No question, that's absolutely the number one thing. I'm so thankful for the research that's come before me that allowed me to use the tools I'm using when treating patients with aneurysms, and so thankful for the patients who have allowed me to take part in their care.
And if there's one message that you would like people to walk away with, what would that be in terms of either diagnosis or treatment of a brain aneurysm?
I think that some people might have some fear about learning about their brain aneurysm, or if they have family members about getting screened, or if they have some symptoms about getting evaluated. But that the message is we have this worked out. And so we can give you real answers about what you should do. And so if you do have family members who have had an aneurysm, or if you are afraid that you've got some symptoms that sound like we've been discussing, then you can don't be afraid to get evaluated, and we can give you the information to make the right decisions, because we really do have very good treatments for aneurysms, and if we find out about them.
Thank you so much. Can you tell people how they can get in touch with you and learn more about this?
Yeah, absolutely. You can message me on Twitter or X, Chris Kellner, MD, or you can email me at my Mount Sinai email, which is christopher.kellner@mountsinai.org, and happy to respond to any messages.
Terrific. Well, thank you so much, Dr. Kellner, for being a guest today on the show. I also want to thank our guests our sponsors once more. The Russo Law Group, Long Island Signature Estate Planning, Elder Law, and Special Needs Law Firm. For additional information, visit vjrussolaw.com, and Buddha Bath, a natural bath and body care company. For more information, visit buddhabath.net. And last but not least, I want to thank you, our listeners, for tuning in each week. If you want more information on this show or any other show, visit us at hilarytopper.com, or you can find us on Spotify, iTunes, Google Play, Apple Podcasts, Amazon Alexa, you name it, we're out there. Have a great week, and we'll see you next time.